Is everybody staying warm? Well, today we're having a heat wave though, right? Supposed to be like in the 30s, I think.
I kind of got used to wearing fluffy socks with shoes.
Good morning, Claire.
Good morning, group.
Good morning, Officer Cruz. How are you?
Good morning. Good.
Thanks for joining us.
Yeah, thank you. I'm glad that this is taking place.
Yeah. Did you see our big announcement for Empower Evergreen yesterday?
Yes, that was huge.
Yeah.
That's huge. So
Excited.
yeah, no, I'm excited. It's exciting to see it all come together and everything that's taking place. So
I know.
looking
Think
forward to it.
of where we started, right?
I know.
Yeah.
Yeah.
Something. Good morning, Vince.
And Janet.
Good morning, Janet.
Good morning, Cindy and Charlie.
We found it's easier if he just is on with me. Otherwise, we get this feedback and all kinds of problems. So it works. Well, while we're waiting for Adrian, I might go ahead and just talk about some things that are going on that you guys might like to know about. And I might open it up to Officer Cruz to see if there's anything from the police department that he'd like to talk about. So we might start there. You want to start, Paul?
Sure. We continue our efforts with the Hispanic community. So hi, everyone. I'm Officer Paul Cruz. I'm the Public Information Officer for the Wichita Police Department. I'm also the liaison officer for the police department and the Hispanic and Latino community. So we continue our efforts with the cold season and with all these freezing temperatures. One of the emphasis has just been in citizens leaving their vehicles warming. I know it's cold, but we have seen quite a bit. But as far as like with what we partner, I'll stick to what we do with Evergreen. We continuously partner with them. We work with the Hispanic Latino community up on the north end all the time. We work with our media partners, our Spanish media partners. And, you know, all I can tell you is that I'm really excited for what Evergreen is going to become. And it already is. I think it's just simply a matter of once everything develops, all the pieces in the puzzles have been put in place perfectly. And I think we're going to see a lot of success on the north end. And it's really going to be a game changer. So we're excited to be part of it. I'm also the chairperson for a nonprofit for Real Men, Real Heroes. And that's also another organization that partners with Evergreen and all their wonderful efforts. So just excited to be here. And I reach out and work with the Hispanic community. I'm in the trenches with Anna and a lot of community leaders here. So I'm looking forward to everything that's taking place.
Thanks. Any questions for Officer Cruz? Anything about what he spoke about, but also just general police questions? He knows a lot.
Congratulations, Paul, on being the chair of Real Men, Real Heroes. That's awesome.
Yeah, thank you. It's an honor, and it has been a challenge, but we have really pivoted and made the necessary changes with COVID, and we continue to press on. And our emphasis is also within the Latino community, and we're going to continue to partner with Evergreen and make an emphasis on Cloud Elementary, Pleasant Valley, and all the surrounding schools. So we hope to keep expanding it.
Good. Did you get the announcement about Ariel Rodriguez yesterday?
Yes, I'm so excited about that. I can't tell you how excited I am.
Do you know Ariel? Do you know Ariel?
No, but I know of him, so that's why. Yeah.
Well, good. I think Real Men, Real Heroes will be an awesome program partner at Evergreen.
I agree. I think it's much needed with the boys up there and all the Latino youth. So we were going 110%, and then COVID happened, right? So like,
Yeah.
I think that's what everybody can relate to. But yeah, no, it was exciting, and I look forward to continue those efforts.
Yeah.
Right.
For those of you who maybe didn't catch the announcement yesterday, we announced that Ariel Rodriguez will be the executive director for the new Empower Evergreen nonprofit. Those of you that have been on these coffees on a fairly regular basis, you might have seen, I gave the presentation on what's going on at the Evergreen Neighborhood Center and creating combining with the library and other nonprofits, Empower Evergreen being one of those, to create a new community center that focuses on workforce and career readiness and on small business development. And so yesterday, the organization made the announcement of a new executive director, Ariel Rodriguez, who has been the executive director for Rise Up for Youth, a very successful organization that he's been the chair or the executive director of for 3.5 years. So very excited to have him, and you can watch for more announcements related to that. So I see Adrian has joined us. Thank you, Adrian.
Good morning. My pleasure.
Those of you this is our guest speaker today, Adrian Byrne. For those of you that do not know Adrian, she is the director of the Public Health Office for Sedgwick County. And we thought that it might be nice to hear from her because I hear a lot of questions in the community about the vaccine rollout, and there's a lot of kind of misinformation or in some cases lack of information. And I thought we just might as well go to the source, right? Adrian can give us that. So Adrian and I have known each other for quite a while. We made I think the first time I actually got to really spend time with her, we went to Tulsa to look at their health organization down there. We did a sister city trip to look at all the cool things they were doing down there. And Adrian, before you came to Sedgwick County, where were you before that?
You know, I've actually been in the health department for just about 33 years. So when I started, we were under the city of Wichita. And then in 2002, for whatever reason, we moved from the city to the county, except environmental health stayed with the city at that time. So in various positions, and here I am.
And here you are in the middle of a pandemic, right?
Yes, yes.
Well, Adrian, I'm going to turn it over to you. Adrian's going to give us a lot of good information, and then I know you guys all have some questions for her. And so, Adrian, the floor is yours.
Okay. And I'll tell you, I was very involved during H1N1, but there's no comparison. This is nothing like H1N1. That was just an entirely different experience, and everything didn't change multiple times a day. So one of the big questions is, why does Kansas have the allocation or the amount of vaccine that they have? Well, Kansas is 1% of the country. And so they get 1% of the vaccine from that is manufactured. And 1% can either be a little bit, and I see Lonnie's on here. He's heard me do this spiel many times. So 1% can either be a little bit or 1% can be a lot. And right now, 1% isn't very much. So 1% ends up being somewhere around 42 to 47,000 doses that the state of Kansas receives. And in the beginning, it was going to hospitals and the National Pharmacy Program for them to provide vaccine to the most vulnerable residents, being those in long-term care facilities. And then we had no idea how much vaccine we were going to get or when. And our first shipment, we received 1,400. And we thought we might get maybe half of what we had for the health department staff. And so we were surprised at 1,400. And then that was right before Christmas. And two of our federally qualified health centers, one, Grace Med, they received 9,000 and they had no idea they were going to get that, and gave us 8,500 of their doses because they're not prepared or trained to do a large scale dispensing clinic like we are. And then Health Corps received 2,000 and have been doing doing some of their healthcare associated workers out into the community, and also assisted the state like we did with taking care of some long-term care facility residents that fell between the cracks because they weren't affiliated with a national pharmacy, which for us was CVS and Walgreens. So let's see, Hunter Health also received vaccine, but from a separate source, being Indian Services on a federal level. So then we didn't receive vaccine for, I don't know, 3 or so weeks. And it would always come in, we would always be notified 12 to 24 hours before. So one of the questions would always be, why in the heck can't you put the darn schedule up, a week or a month in advance? We have lives, we have work. I mean, come on, people. We didn't know, except for 12 to 24 hours before we received vaccine, that we were going to get it and how much we were going to get. So it was very difficult to plan. And as soon as we knew how much, well, back up a minute. So we didn't think we would be doing a large scale clinic until it opened more to the community. And so maybe April, May or so. So when Grace Med got the large amount they did, then we decided, well, okay, this is our opportunity to go ahead and open up to a large scale clinic. And so already had some of those pieces in place. And so I think within a handful of days had Interest Arena set up. And we had been doing some vaccinating of healthcare associated workers and EMS and health department staff just at health department locations before that. So that's kind of the background as how Kansas gets what they get. And they're still reporting. There's lags, there's issues on a state level with, I don't know how the reports are pulled, how they query, and not all gets picked up in the query. So what is reported is different from the vaccine that has already been dispensed. So as of either Wednesday or Thursday, all the days they're all the same. It's hard, I don't know. So the state is putting in a new reporting program, really an expectation for all providers, anyone in Kansas that is an approved vaccine provider. We need to show them, there's like screenshots and some of the form on a daily basis so they can actually get a picture of what we have, because WebIZ is the state vaccine system that we always put all of our vaccines that we give children go in there. Flu, anything that we give is in there. So we're very familiar with that. Some of the vaccine providers are not familiar with that. It's a whole new system, but there's discrepancies even in what we have. So it's not just those new reporters. I'm not quite sure. It's just not been a smooth process. And maybe part of it is that WebIZ is more overwhelmed than it's ever been in its life, with the system, because there's so many providers, so much vaccine going in there. But this should be getting cleared up. It's going to be a different process since they can't count on WebIZ at this point, just to go through what they're being sent on a daily basis so that we can give an accurate picture, because we're not 49th. There's no way that we're 49th. And we don't have all the numbers, all the vaccine that's been provided in Sedgwick County, because the states, I asked before we started dispensing vaccine, will you be telling all of the counties in Kansas how much vaccine is being given on a daily basis so that we can report it? No, I mean, they didn't say no, but they basically said that CDC has we have to report to CDC every day what our inventory is. And then we report to KDHE every day how much vaccine we've given. So their thoughts were at the time, because they're overwhelmed like everybody else, that CDC would have all the information in the vaccine finder and would possibly provide that information. And since then, KDHE has set up their site and are attempting to do that. But we don't know how much the hospital has dispensed. their initial numbers I heard when they first got the vaccine and vaccinated staff was about 6,000. So the number I'm going to give you, I can say I think we're probably closer to 50,000 doses that Sedgwick County has given, all in all, because again, we have the Indian Health Services through Hunter Health, and then Grace Med, I think, has given approximately 500, and Health Corps might be more around 1,000. As of yesterday, we have given a total of 35,489 doses, and of those, 24,623 are first doses, and of those, 10,866 are fully vaccinated. So that's the amount in our community through the health department that have been vaccinated. There are thousands of healthcare workers separate from us that have been vaccinated, that are totally vaccinated. So 3 weeks ago, we were, someone from KDHE called me and said, hey, if you can handle Pfizer, which is a very finicky, everybody wishes they had Moderna. You draw it from the vial like you do any other vaccine, and you vaccinate somebody. Pfizer, you have to reconstitute. So you have to add a solution to it. And then you have to, I have a cat that's trying to be playful, stop it. And so with the Pfizer, you have to reconstitute it. So you have to add saline, and very gently. If you shake it, you ruin it 10 times. You have to shake it. Sorry, don't shake it. You have to do this to it 10 times, and then you draw it. It is drawn into the syringe. And the most important thing that people aren't prepared for is that the freezer temperatures you have to keep it at. So you have to have special freezers, which we have. And so Johnson County, Wyandotte, and Sedgwick County all receive Pfizer. We have gotten some vaccine, about 2,400 doses from Wesley, Moderna. And in the beginning, all we got was Moderna. So we had 9,900 doses in the beginning, 8,500 that were from Grace Med, and then the 1,400 that we had. So they said, hey, you're going to start getting 7,000 approximately. Well, it was 57. So in the beginning, Pfizer, you can get 5 doses out of Pfizer, 10 doses out of Moderna, and it's pretty steady with Moderna. It's 10 doses every vial. Well, with Pfizer, you could get 5 doses, but early on, a lot of hospitals and places that had Pfizer were reporting they could get 6 doses versus 5. So that became consistent enough where Phil Griffith, who I was talking with, who's like overall vaccines at KDHE, said, so the good news is you're going to start getting 5,700 doses of Pfizer, and next week it's going to be 7,200, but you won't be getting any extra vials. How does that work? Well, because they were going to start counting 6 doses per vial versus 5. So it's a little bit over 7,000 doses that we received 2 weeks in a row or 3, and we would know 24 hours before we would get the shipment. Well, the second week that we got it, we were thinking, okay, this is 2 weeks in a row, this is good, but we still don't set up appointments for first doses until we get that shipment notification, which is good because we didn't get any this week. And so if we would have set up appointments, we would have been hurting like one of our sister counties that needed like 500 Moderna because they had a site set up and didn't get their vaccine. None of us got the vaccine because of the cold weather. It wasn't shipped, and they didn't want to ship it because of concerns that it would get stuck somewhere, and which was probably a pretty good decision. So we actually still had some Moderna, so we have given that Moderna to our sister county, and then they'll just replenish us when they get theirs. But so we didn't get our Pfizer this week. And so since we book the appointments we have, and we always have first and second going at the same time. And so we really don't want to start giving more Moderna. So we started out with healthcare associated workers. So we had that Moderna, 3 weeks later, because Moderna is 28 days after the first, there's 28 days between first dose and second dose. And it's at least 28 days. So it's preferred 28 days and after. Now we know there's a week's period of time where it's still okay to get it, but we really want people to get it on the day or several days after. So we received the prime, and then 3 weeks later, we received the booster. With Pfizer, we've received the prime. 2 weeks later, we received the booster because it's 21 days difference for Pfizer. So we got the Moderna in, and then we started doing Pfizer. So then we had first dose Moderna, first dose Pfizer, second dose Moderna. Now we have second dose Pfizer. We're just about out of Moderna, and we're glad, because doing all of those different lots, and it's tricky, but we separate it. We have what we call separate pharmacies. And so we have staff that are medical staff that are drawing up the vaccine and getting it ready. They're in one room, and Pfizer, Moderna are in separate rooms. We don't have nurses drawing the same vaccine. I didn't want, there's enough challenges that come with a clinic every day, as I'm sure you've heard some, that I didn't want to, this is something that we definitely have control over. So they are separate. We don't have the same people drawing Moderna and Pfizer, and don't have the same vaccinators doing Moderna and Pfizer. So that all is separate. So we didn't get vaccine this week. And so people that are going to the clinic this week, they are in and out because we didn't get additional vaccine to open up additional first appointments. So we had the appointments for the vaccine. We have all the second appointments that we need to get the ending of the Moderna and those 85, 80 and older, their second dose, but that left plenty of spots at the arena. And we had some first doses, but we add when we know we're going to get that shipment. Well, we didn't get that shipment. And so now we know that we're going to get double next week. So there's plenty of spaces this week for people to just come in and come out. The okay, so how do we decide who we go to in each phase? So phase one was very clear. It was healthcare associated workers and long-term care facility residents, but the counties weren't really part of that unless there were some that weren't being taken care of. And then counties, health departments were seeing if they had vaccine to work them in, and we have. And then there were a couple medical facilities, a surgery center, and another one that somehow fell between the cracks, because there are a lot of places, clinics, pharmacies that are approved vaccine providers. And if you are an approved vaccine provider, that means you can get vaccine directly from the possibly federal government, like some of the pharmacies are, the hospitals did. One of our FQHCs now is going to get some vaccine, or you could get it from KDHE. Well, it was decided, as it was during H1N1, that the health departments would become the main hub versus the state deciding who gets what when they really don't always know who exactly needs what vaccine. And so we became that main hub, which is why we started getting what is now 7,000 doses each week, because all health departments receive, not a lot, but some funding for public health emergency preparedness. And this all happened after 9/11, when it became clear that health departments didn't have the infrastructure to stand up and be part of pandemics when they occur. So it's also when Medical Reserve Corps was established, or MRC, for managing volunteers, because at 9/11, they had lots of medical staff showing up, and they just took their word that they were doctors and nurses and surgeons and whatever else, and used all that they could use given that huge disaster. So they found out afterwards, not everybody had the credentials. So Medical Reserve Corps was established, and now there's a system where we look at everyone's background so that we know that they're licensed, and we plug them into the various places. So, okay, so and I will say in the middle of, I have many veterinarians that are very unhappy with me. In the middle of phase one, Katie, she decided that they would put veterinarians in there. Well, we already had all of our vaccine allotted for phase one. And so there was not any for veterinarians. So, and we were being pretty rigid about who we gave vaccine to, so we would turn people away. My goal from the beginning has been managed chaos, straight and simple, managed chaos. And because that's what, this is what COVID has been since day one, because information changes so quickly. Just think about where we are now with masks, where in the beginning, we didn't really want people, you didn't need to wear, save the surgical masks and don't wear a mask, but we have found a lot out since then and know what a difference that masks do make. So when we went into phase two, we still didn't prioritize veterinarians, because what we were doing then, and this is a team led by Dr. Menz, our health officer, and Dr. Hagan from Wesley, Dr. Davis, who represented not independent doctors, but doctors in the community with clinics, and myself, and then a consultant. And we looked at data. Who do we go to? Who is at highest risk in phase two that we move on to? And honestly, veterinarians aren't. And I understand they're in a small room, but compared to 65, so they're going to come after 65, but where teachers were going to be in law enforcement. So why did we start with 65? I know that like Johnson County started with critical infrastructure. Well, I'm not quite sure how that decision was made. I know that some decisions are being made around the country and even counties because of the intense political pressure. So we started with 65 and older, starting at 90 and then 87 and 85 and moving our way down, because we know data shows us that 65 and older are at highest risk for death and hospitalization. That is clear across the board. And the higher and the older one is in that age group, the higher the risk is, the higher the rate of death and hospitalization. And so we're wanting to keep people out of the hospital and keep them from dying. So that's why we've incrementally, and so why didn't we just open it up to 65 and older? Well, we know from data that there are over 75,000 65-year and older residents in our community. I was afraid if we opened it all up, that the older population would be trampled on. I mean, not literally, but not as quick to get to the computer. Maybe not everybody has a computer, not everybody has internet access. So broke it down that way. And then we opened up a phone line just to help people that either didn't have access to a computer or that it was too confusing how to make an appointment online. So that line is very difficult to get through to because people just don't use it to call. They're using it, to call and complain about long lines or whatever. So it still ends up being difficult. After the first day that we opened, and some of these things, anticipatory awareness is really important for me. But I tell you, I haven't always been able to do it just because of the speed of the pandemic and having to adapt sometimes by the minute. So the very first day that we opened up to 90 and older, it was, and we were at the arena. Today's our last day at the arena, actually, and I'll talk about that in a minute. It was windy. It was awful. And so people were coming with walkers, and there was one that got into a divot. That person fell over, had to call 911. It was just awful watching people struggle. And this is a proud bunch of people, and I imagine I might be the same, but I'll have to remember myself now. Although I'm not that far, but that we would say, because I was saying, hey, we need to get people to help people out to the car. This is dangerous. And even though they at that time they were coming more individually. So people would, like their son or daughter or caregiver would drop them off and they would come to the arena. was so, then I was like, we need to get people to help them out there because it's windy. Well, they wouldn't want help. I can get out there by myself. And I've spoken with Tom Fletcher since, who was with CommCare for a long time, and he gave me suggestions on how to approach that, where it seemed like it was something more that, this is part of what I have to do for my job, and but versus something to help them. So, but at the time I wasn't thinking that way, so I was just stressed out, not wanting anybody to get hurt. So after that day, and it makes sense, that we opened up a drive-through clinic for those with mobility problems, which we should have done from the beginning, just weren't thinking in that way. And staffing has been such an issue in regards to medical staff. We had, from the beginning, we had temporary agencies that said, we're not sending you staff that are going to be, this was when we were doing testing, which we're still doing testing. But when we had our drive-through testing, temporary services said, we will not send you staff that are going to be anywhere near the COVID virus. So we couldn't get medical people that would, that were able to sample. So we used our own staff for quite a while and went into our COOP mode, which is a continuity of operations plan, when we pull from our own staff. And that's what we did in the very beginning when the community looked at us, and even the medical community, and said, why aren't you testing people? Well, we vaccinate. The health department, we test for sexually transmitted illnesses, but we're not testers. The medical staff or the medical community are testers. But everybody was so overwhelmed by the pandemic. No one really knew what to do, and were thinking in the way that they usually think. So a big part of what we're here at the health department for is to fill in gaps in the community when there are needs. And so, okay, let's set up a testing site. So then we found that we were having a hard time getting people in because so little was known about COVID. People were very afraid of it. So in the beginning, staffing is another problem now, but in the beginning it was really a challenge, because once we started going back to providing some of our own services, because people still needed, we couldn't postpone family planning too long, or we're going to have a big, boom of babies that, weren't necessarily intended. So got that taken care of. We've hired a lot of staff. That the county gave us the go-ahead before we knew about CARES money to hire lots of staff. So we probably have added an additional 100 staff, but it's been difficult to find some people because it's temporary. So then we've gone to temporary services. And now that we're at the clinic, finding enough vaccinators has just been a real challenge, because everybody needs nurses. Everybody needs medical assistants that now, because of emergency declaration, you can use like medical assistants, phlebotomists to give shots where ordinarily you wouldn't. So it's been a challenge. So that's part of the reason we didn't even think about, I think, a drive-through. But so we have a drive-through, and we're not going to have it forever, because it's not for convenience, because it pulls away from our ability to be out in the community doing mobile clinics. Because from the beginning, we wanted to do mobile clinics to reach those areas that are traditionally underserved, to reach the neighborhoods and zip codes of color that we know are going to be less likely to go to what seem to be large institutional places to be to be vaccinated. So all of these things are pulling away. We're still doing mobile testing in Cheney and 214 and all these areas, but and that's still needed. Some health departments have shifted from that to just doing vaccinating, but we're still wanting to do both because we know there's a need. So we're still working on that, because we want to be able to go out and vaccinate in all types of different communities.
Hey, Adrian,
So yes.
we have a couple of questions. Do you want to take those now?
Absolutely.
Okay. I know if we were in a big room, people would just be raising their hands, and it gets more difficult here. But I think Monica, that's on the call, she represents food processing, grocery, and retail workers. And Monica, can you use your
Yes,
Why
yes.
don't you
Hi,
ask the
good morning.
question?
I'm here.
You want to go ahead and ask your question rather than me reading it?
Oh, okay. Yes, as you just mentioned, I am political director for the Union of Food and Commerce Workers, who represent 11,000 food processing, meat packing, and grocery retail workers in the state of Kansas. All these group of workers, many of them living in Wichita, and most of them belonging to minority groups, have been from day one in the front line, and they were told that they have a high responsibility and they were essential at the moment to keep the plants open, even when they have been working for over 10 months with being exposed to the virus, and with even though they have been able to receive PPEs and certain measures, minor measures like high sanitizers, the most important of them is the social distancing, and that is one that is impossible to implement on most of these fields where they work in.
So Monica,
So
what's your question for Adrian?
yeah, exactly. So my question is, even though these workers have been categorized in phase 2 as at high risk of contagious and plus being critical for the infrastructure of the state, we haven't heard anything about these groups being prioritized. And I've seen groups that are in lower risk contact fields being prioritized over them, like, for example, social workers.
Thank you.
Okay, so we are following CDC and KDG guidelines. And so right now we are doing the most at risk given data as far as who's been hospitalized and who is most at risk for death. And then we're going to be looking at, we're still using data with where have we seen the most clusters? Where have we seen the most cases? So, as you can imagine, we are all bombarded with, questions like that, and those with very good reason wanting to be moved up that list. So we're actually having a meeting next week with Dr. Menz to decide, after we do teachers, because now this is a state push that we were going to do. Right now, teachers are being done by age group, just like everybody else. You have to be 70 and up. And I was hoping to move to 65 and up, but the vaccine not being available this week has delayed that a little bit. But as of, I think it was Thursday, when the governor announced, which we didn't know was going to happen, communication's been, we usually as health department directors find out the same time that the community is finding out what is occurring, which is not how it should be, but that's how it's been since day one. So on Thursday, we were alerted that teachers, the goal is, get the kids back. Absolutely, the kids need to be back in school. And so the teachers are being, not just teachers, the school personnel are being prioritized, and we're going to start receiving extra vaccine, 3,500 doses a week for at least 3 weeks to get everybody vaccinated. And that's moving like wildfire, actually, with pharmacies offering. And so after that is law enforcement. Most law enforcement have not been vaccinated. We do have them on our call down list for when we have a vaccine, because my goal, everyone's goal, is zero wastage. And what I hear going on around the country is just mind boggling, but zero wastage. So excuse me. So law enforcement, so we're going to be doing teachers next week. We're planning meeting this weekend again about plans on how to roll all this out. And then law enforcement. And then, so what we're doing this week is meeting to prioritize those critical infrastructure groups and how to prioritize in that group as we continue to get limited minimal amounts of vaccine in. So why people with cancer and pre-existing conditions are in phase 3, I don't know, but we don't have the ability, don't agree with that. Dr. Minnis doesn't really agree with that. And I asked Katie Chi last week, has there been a lot of talk about people with that are immunocompromised and or have cancer, about moving them up to phase 2? Yes, there has been, but there probably will not be. So I don't know how all these decisions are made, but we are, obviously in the beginning, meatpacking employees were just such at high risk and getting large, high amounts of cases. I regret that the word essential was ever used on a governmental level. And when we opened up to phases, I told my staff, because first there was that word in there again, I said, no one is to use that, because that had such negative connotations, and it was hard psychologically for people, because suddenly they weren't important, and that was not what was ever meant. It was, critical to the country maintaining, So an answer to your long answer to your question, we're going to be meeting this week with Dr. Minns and looking at numbers, looking at data, and outlining who goes where. And again, we can't move into phase 3, or Dr. Minns would have pulled up high risk, those at high risk for complications to COVID, like those with cancer. And so, and I will say, after, got to get veterinarians done, since they were supposed to be done in phase 1. And so we'll be moving on to veterinarians as well after we do 65 and older, small group. But congregate settings, that's where we're also going to have mobiles, because we're going to go into the congregate settings, helping the, jail, we'll probably do pods, which are like mobiles, where we go and get the jail staff, the employees taken care of. And I know there's been questions around the country of, why would you vaccinate inmates? Why would you waste vaccine? Well, the reality is there's a lot of staff, and there's two things. From my perspective, there's a lot of staff taking care of those inmates, and they have had a lot of clusters, a lot of cases. And those people that are in jail for whatever reason, some small, some large, are coming and going all the time into the community. So they can also be spreaders. But we have a lot of staff that have gotten COVID because of the population. But we'll be going into congregate settings, and we'll be going to them and providing staff to be able, and oftentimes they have nurses that we can together get a lot of people, get a lot of residents. And these are not long-term care residents, these are other residential facilities, Heart Springs individuals. I mean, just anyone that's in that type of setting. So more to come on that as we look at all the data, and there's just so many things to take care of at any one time. We haven't gone further into phase 2 and phase 3 until we get closer to it, because it takes so long to go through various individuals. So it's not that there's no transparency, it's just that it has not been done, because as KDHE and CDC have their phases, they're very general. And so we have to dig down a lot further than what they have. So we may or may not prioritize someone behind a plexiglass if we know that their case numbers have been low. So, but more to come on that. But we know there are a lot of vulnerable populations out there.
So Adrian, another question we have from Monique is about, are we utilizing the vulnerability index data to identify how best to engage with communities of color for the vaccinations?
Well, and that goes back to the mobiles, and Health Corps has some vaccine, and we are partnering with like the Black Nurse Association, and I know our communications has someone working in the Hispanic community, but for communication, because getting information out has been a real challenge from day one. But that's where those mobile pods, those mobile clinics are so important, because we're only going to get so many at the arena. But again, we're going by age. It's all by age at this point, because of the vulnerability. That's where they are the most vulnerable, in addition to those in long-term care facilities. So we have, from our community health assessments that we do every 3 years, we know the vulnerable populations, we know the zip codes, and that's why with testing we've been doing, and Health Corps did also in the beginning, go into various zip codes and community centers and do testing in those areas so that we could get those historically underserved. And the goal is the same thing with vaccine. And what the holdup is personnel. So now that we've been working on a plan to utilize partners. So those partners who are approved vaccine providers, we can transfer vaccine to them. And transferring, which is what we want to do, because transferring means they're responsible for entering it into WebIZ. They're responsible for the data. They're responsible for the paperwork. They're responsible for the vaccine. But even if someone isn't an approved provider, we can redistribute vaccine to them. It's just that we're responsible for everything. And everyone that we're in the process of dispensing to next week, and we did give some to USD 259, they're the only approved provider, which means they jump through a lot of hoops with the state to be able to become an approved provider, had to, have the refrigerators, had to have all of the equipment in place to be able to do that. But even when we do, whether we transfer or we redistribute, we had legal draw up a memorandum of understanding that there will be no wastage. And if there's wastage, then we're not going to provide vaccine. We're not going to share vaccine again, because that is so important. And it takes work. We're usually at the clinic 2 or 3 hours after it closes because we're going down our call down list. People have 20 to 30 minutes to get to our location, and it's not very much time and it doesn't make people happy. But our goal isn't to get that individual vaccinated. Our goal is for no wastage. And so we move down to the next person if they can't be there in 30 minutes, down to the next. As of Monday, we're moving to the library. So we're not going to be at the arena anymore. The arena has been, outside of it being very overwhelming for a lot of people, because first of all, which damn door do you go into? Very confusing. And it's a large entity. And so there's certain populations that don't really want to go there. That staff has been fabulous. It's just that they have other events occurring. And so at least once a week, we were moving to East 9th, which is not the best setup for throughput. So now we're moving to South Main Street. Is it 233, 223? South Main Street with the old library, which is going to be a fabulous location. We'll have to see how we do there. There's not quite as much line for people internally. But we'll be there Monday through Saturday, so all the time. And we're continuing our drive-through, again, not for convenience, just for those that really need to be there with walkers or canes, so that we can serve them. And
Adrian, I think Rachel has a question.
Yes, thank you. Hi, everyone. My name is Rachel Shostak. I'm an associate professor of Spanish at Wichita State. And I'm also affiliated with the Institute for Health Equity Advances, a new institute that's being developed at the university. And I've been leading a group in Wichita for the past year, starting a little bit before the COVID pandemic came to the US, to address issues of language barriers in healthcare in Kansas. And we've been having a lot of discussions about the barriers to getting information out to the Latinx community in Sedgwick County. And so I just wanted to ask, I know you said that you have someone working in the Hispanic community for education, but I'd like to know a little bit more about what's being done to get information out to Latinx individuals about the vaccine and the safety of the vaccine in a culturally relevant way. In my work with the community, I'm learning that people have a lot of questions and a lot of doubts. And so getting that information out there is so important, since
It has been a challenge for sure. And that communication piece, the county communications took over. And so I don't have my hands in directly in that piece. I can connect you with Tanya. And of course, I'm blanking her last name, which is awful, who is an assistant county manager and who they are working with that. Definitely open to any suggestions and recommendations. We do have information on our website, but the reality is only so many people go to the county website for information. Probably more go there now. We have it in our materials in Spanish and Vietnamese. And have those available at the arena when people are coming to be vaccinated to ensure that they have that information. I don't know all the avenues that the county is utilizing with that. Again, that's something that I'm not intimately involved with at this point. But any recommendations, any
Yeah, I definitely have some suggestions for that. I think, well, one thing, we know that some of the information has been translated using Google Translate, and we want to see it translated by a professional translator at all times.
it should be.
In a way that is,
We have, the county has a translator. Shouldn't use Google.
that's good. And then also, not just translating the information that's on our website, but disseminating it through the community in a way that can ensure that the information actually gets to the people it needs to reach, because the people who need the information are not necessarily going to know to go onto this website. And it may be people with, depending on the level of health literacy of the audience, it may need to be disseminated in different ways.
Yes.
Thank you, Rachel. And I think
Also, I'm sorry.
And if you want to email me, we can talk about that, because I would, if there are definite pockets, and I know there are gaps all over the place, I would love to be able to find out how we can better do that and get that information out there, because I know there's still a lot of misinformation and missing information. So any way that we can do that, if you can email me at adrian.byrne@sedgwickcounty.gov, I'll connect with you and find out how we can better disseminate that information.
Okay.
And Rachel, I think, as Adrian said, Tanya Cole is the assistant
Yes,
county
thank
manager who's working on this. And I know she'd be happy to, as Adrian said, she'd be happy to talk about that, because they are trying to
Absolutely.
figure out the best way to do that in as Adrian said, a managed chaos time. So
Right.
thank you for offering that. I think we have a few questions from our Facebook audience. So Anna, do you want to pitch one of those questions to Adrian?
Yes, the first question is the second booster vaccine different from the first dose?
It is more how our body responds to it. And so they can be interchanged. There's a lot of misinformation out there about that, and even in the medical community. But it is how our body responds to it. So we could use, and part of what we're going to do, since we haven't received our vaccine, is we can take our booster bunch and move it to our prime, which will be our first, so that we're not going to wait on vaccine that may not get here until Wednesday or Thursday next week, and open up appointments for next week for dose 1.
Thank you. Nick, do we have any more?
No, it was a question around the same, it was a similar question. We do have some comments and some, I think, additional questions in the chat portion.
Oh, let me look.
Hey, Cindy, can I jump in real quick?
Yeah, absolutely, Officer Cruz.
Adrian, I know managed chaos. We live it almost daily. I'm with you, and I get it. One thing I do suggest, so I'm switching hat to with the liaison of the Hispanic community. One suggestion I would make is, and this is just more of a plug, hire a liaison position like myself in these moments, even if it's just a temporary. And I don't know if you're aware, but a lot of that information with what Dr. Shostak was saying is not translated correctly, whether it's your website or the Sedgwick County's website.
Okay.
So just an FYI, I don't know if that's if there's any oversight on that, but I want to make you aware. And I think this is where a lot of this is coming from. But yeah, I mean, a lot of the information just simply isn't getting out to the community, especially our Spanish speakers. And there's a lot of misinformation, a lot of lack of, I mean, I like to see it when you're giving out daily updates or the county is giving updates on a continual basis that you include other languages along with sign language. But I realize that current circumstances make it limit, but that would be, I think, very, very beneficial. And that's what 82,000 Latinos, which mainly are Spanish speakers in our community. So keep doing what you're doing, but I think that needs to there has to be some sort of change there because there's a lot of misinformation. I can tell you as someone who I'm getting asked questions about COVID, and I'm a police officer, and that should not be the case. So I just want to encourage what you're doing and see if there can be some sort of oversight on that side. So just a quick plug, that's all.
Although I'm glad that you have some information because it is important for so many people to know because this is, affecting all of us in a pandemic. So that is actually helpful because we also are going to rely on community partners to be able to dispense as well, because we know that even though there's always some sort of a media interview about it, what if people don't have cable? What if they don't have a TV or they're not even watching that, or social media? How many people don't even do social media or the newspaper? And so, and again, more people go to the county site now than before. And I'm distressed to hear that it seems like there's Google translation versus other material on there. So I'll be on that. But it has definitely been a challenge, and that's been a criticism from the beginning of getting information, even English out, English speaking, or like we have no way of knowing what the heck is going on. And I'm not quite sure, totally open to how we can do a better job of that. That is just a real challenge. So I appreciate the feedback on that.
Thanks, Adrian. I'm going to
Council-
just a little bit because I have received a couple of other kinds of questions from the community. One is, and you talked about this a little bit, but when you put appointments out on the web for people to sign up or to call, how quickly do those fill up? I know it depends on how many vaccines you have, but how quickly do those fill up?
I bet you within a day and a half. They are gone very quickly. And that's, and that just reinforces why we did not open up to 65 and older. That, even deciding to go to 75 to 70, that there's just a lot of 70, 75-year-olds in there. So we don't begin opening up to another group until we see that those appointments don't fill up, because then that's an indication that there is some saturation and maybe some are still waiting, which is fine, because once we open up, anyone, like any healthcare worker that was part of phase 1 that didn't get vaccinated for any reason can still get vaccinated. So it will always be open to whoever could have gotten it at that time.
Okay, thanks. And I think Amy has a question. Oh, Dan has a question. Hey, Dan.
I appreciate Adrian mentioning the jail. I think that's a big, I think there's been controversy about that, which I find to be frustrating. I appreciate the 2 points you made. There's just, I think the other point that's important is most of the people that are in the jail are not guilty of a crime. And with speedy trial statutes suspended, we have indefinite detention of people who are not guilty of a crime, and to have them in a congregate setting without offering them protection from the coronavirus, I think would be a really unethical approach. So I just want to add that to people. If you hear questions about that or people bring that up, it's helpful to have talking points to kind of respond to say, actually, we talk about those folks like they're maybe less than, and in fact, most of them are in really, really difficult situations. And we have an opportunity to protect them and to treat our prisoners well. And I think that's important.
And Daniel, I think that's a good point in that the jail population and prison populations are two separate populations too. And
yes,
recognizing that. Another question that came up, Adrian, was we've heard about lines, and my understanding is that if you show up too early for your shot, that lines form. But if you show up within 15 minutes or on time, that you get them right in. Can you talk about that a little bit?
It is a real ebb and flow process. And again, this week with having less first doses, people were able to get in pretty quickly. My goal, in the beginning, my goal was people to be not there long at all, but working with healthcare workers when we could do 1,800 in a day is very different from the older population that move a little bit less quickly and often bring at least one person with them. So, and come early. So that has been a big challenge because I've, been sometimes I've gone over with the sole purpose is to spend my time making sure people are social distancing. And having some fun with it. If they're too close, do you guys live in the same household? Oh, you don't? Well, you probably have to space a little bit. So that, just to say that has been very important to me. And then I've heard that sometimes they were pretty bunched up in there, and the choice of that, sometimes your choices aren't very good. It's either have people outside, which we weren't going to do in sub-zero weather, or they stand in. So on those days where people were close together was getting everybody inside with people showing up early. And if we would say, you're here an hour early, would you please wait in your car? Sometimes they would say no because of being afraid of somehow not getting vaccinated. So really trying to stress to anyone that has an appointment, we have a shot basically with your name on it. So, but there's a lot of fear around not getting the shot, not getting that dose, and that somehow it's first come, first serve, which again, it's not, because there's vaccine for everyone if you have an appointment. But that has been a frustration for all, because we would never want to be a hot spot because people are too close together. So doing what we can about that. And as the weather gets warmer, we'll have lines outside again, because just can't have people back to back.
Thanks. And then I know we're at the 10 o'clock mark. I'm going to ask one more question from the audience, maybe two more. Maybe these are quick answers. One is, and then we'll close for the day. One is there any consideration about using the National Guard to help with any of these activities?
I'm not sure if we have reached out to the National Guard and exactly as far as helping with lines, or, I mean, we have staff to do that. So that hasn't been so much the challenge. It's been the space, because of if we're doing 50 appointments every 15 minutes, 200 people, if a lot of those people come 2 hours early, you begin to see the challenge.
All right. And then one last question. Someone asked about the COVID vaccine interest survey. Was it made available in Spanish, and was it offered on other platforms other than online?
The vaccine survey, it was available in Spanish and I believe Vietnamese. And I don't know if we dropped off paper surveys anywhere or not.
Okay.
Actually. But it needs to be done again, because my answer changed to getting the vaccine from the time I took that. I'm fully vaccinated now.
Good. All right. All right. Well, Adrian, thank you so much for joining us today. I know we had a good group here on Zoom, and we had people on Facebook that were joining us also. And Anna recorded this so people can watch it later if they weren't able to join us right now. So let's all give Adrian a hand for coming and visiting with us today. Thank you all.
My pleasure.
All right. Well, everybody have a great week. Are there any, I guess I should just ask, are there any burning questions before we're done? We are at the time boundary. What's that?
3 new messages.
3 new messages. They are just,
Oh,
thank you.
There
Yeah.
was a question from Officer Cruz that I'm not sure if it was answered.
I think it was
Yeah, I
about.
think you got, no, I think I got most of my questions in, Rachel.
Okay, good.
And I think, as Adrian mentioned, I think some of these we can take offline and work with Tanya Cole's office in terms of communication. So
Absolutely.
thank you
Yes,
for bringing
yeah.
those up. I think that is something that's very useful. All
And I
right,
will get online on the information online and see what's going on with that. Thank you.
Thank you.
all right. Thank you all
Bye.
for joining us. You all have a great rest of your weekend and a great week.
Hey, Cindy?
Yeah.
Can I chat with you afterwards?
Yeah, I'll stay on.